So today we're going to be going over the pathophysiology introduction slides, and keep in mind that I don't know how to say some of these words, and if you want the full definition and not me simplifying it, just pause the video and read. So pathophysiology is the study of when something goes wrong in the body and how your body processes it and handles it. Let's look at the framework. So, etiology is what's the cause of this happening? Why did you get sick? Like, how did that happen? Pathogenesis is how the disease develops and how it spreads in your body. Signs and symptoms is what's the evidence of this? Like, what is showing out? Diagnosis is now what can you prove? Like, how did you prove that something's wrong? Treatment is okay, so now you know what are you going to do about it? So, for etiology, keep in mind for two things, idiopathic and iatrogenic. Idiopathic is basically, I don't know why that happened, and iatrogenic is, oops, my bad, and it's the result of an unintended medical treatment. Now, let's see the difference between signs and symptoms. Signs are subjective and symptoms are objective. Signs are something that the patient can tell you, like, I'm feeling dizzy, it can't be measured. Symptoms is like a broken fracture that you can see on an x ray. Let's look at the stages of getting sick. So the latent period is the period of you being exposed, so you being around your sick friend. The prodromal period is the first small signs, so you got a sore throat, but it's not clicking that you're just sick yet. Now the acute phase is when it's trying to be cute. It's at its peak, and this is the sickest you're going to get. The subclinical phase is when the disease is there, but you're not getting any symptoms. So what's the difference between acute and chronic? An acute illness is something like the flu. It's short, it's days or weeks. Chronic, oh, you're sick, like it's months or years. So, exacerbations are when the symptoms get worse, and remissions is when the symptoms go away or they improve. And the covalence period is the recovery period. So now that like the peak is gone and now you're getting better, but you're not like just normal all the way yet. And the sequela is the sequence illness. So, what are factors affecting disease? There's age, gender, genetic, and geographic. So, children and older people are more vulnerable. Some diseases, male are more vulnerable, female are more vulnerable. Where you live plays a big area, and like, what are your genetics? So, there are ways of preventing of getting sick. The primary way of getting sick is just avoiding it in the first place. So, staying put up, staying clean. Now, secondary is identifying diseases before they get serious, like getting a breast exam regularly before, your breast cancer gets too bad if you have it. And tertiary is treating it. So, basically, like medication and stuff like that. So, plasma membrane is the protector. It keeps the intracellular fluid inside and the extra stuff outside, and it protects the stuff inside like the nucleus and the mitochondria. Keep in mind that membrane proteins perform most of the membrane functions. So what happens when the plasma membrane is damaged? Okay, so too much fluid can enter the cell, and this is cellular edema, and it causes the cell to swell. Or the fluid can leak out the cell, and this is cellular dehydration, and it causes it to shrink. So let's talk about the sodium potassium pumps. It keeps the cell in check. It keeps the sodium levels low and the potassium levels high. Because literally, if too much sodium is in the cell, it's going to burst. And keep in mind that ATP needs to be present while this is happening. Energy metabolism is basically how we get food into energy. And we basically use ATP for this, and keep in mind that ATP is not stored. ATP is made as it's needed. And there's two ways this kind of happens. Is aerobic metabolism is when it happens inside the mitochondria, and anaerobic is when it happens outside the mitochondria. So mitochondrial DNA is the only organelle with its own DNA, but it's subject to mutation by oxygen-derived free radicals. And you're going to be like, what are free radicals? They're kind of oxidants, and they disrupt the cell membrane's integrity, and they damage the organelles inside, basically just making chaos in the cell. But antioxidants like vitamin A, E, or C can counteract these free radicals. So lysosome is what basically cleans up the cell. So they break down substances and they clean up or recycle old cells, or even autolysis. So autolysis is when a cell is dying, lysosome release everything and they just digest the whole entire cell. Keep in mind that white blood cells, especially macrophages, they have a lot of lysosomes. So ribosomes are the factories of protein, and they're responsible for building proteins. They make different proteins for different cells, and you may be asking, how do the ribosomes know when, or how to make proteins, and the nucleus gives them all that information. And the nucleus is the smarty pants of the cell. It houses the DNA of the cell. It tells all the cells what to do, and all the genetic informations, which are the chromosomes, are in there. Now we're moving on to chapter 2. So, when cells are injured, what can they do? So, adaptive changes are basically the good changes, and they try to adjust and cope with the injury. And maladaptive changes are not the so good changes. So, the cells become abnormal, they get abnormal changes, and it can worsen the cell's condition. Let's talk about homeostasis. So homeo is the same and stasis is stable. So homeostasis about keeping things steady. The set point is the equilibrium. So like how the body should be, like the default setting of the body. The fight or flight is the body's response to stressors. Stress is anything real or imagined that threatens this balance. Now a well-functioning cell can maintain homeostasis, and it keeps the body stable and healthy. So in cell injury, when cells are hit with too much, they can die. But if it's not too bad, then they can stick around. And you might want to look at that terminology to keep in mind. So let's look at cellular adaptations. Atrophy is decreased cell size. So basically, an example of this, when somebody's paralyzed, like if you ever seen somebody in a wheelchair and their legs are real skinny, it's because they don't use it. So, it gets smaller. Hypertrophy is basically increased cell size. So when you go to the gym and make your body stronger. Hyperplasia is increased cell number. For example, when somebody is pregnant, they got more cells. Metaplasia is the replacement of one cell type to another. Dysplasia is deranged cellular growth, and it can lead to cancer. And neoplasia refers to cancerous, disorganized, uncontrolled cell growth. So now let's look at some causes of cellular injury. Hypoxic cell injury is when cells don't get enough oxygen. So an example of this is suffocation or airway obstruction. And free radical is basically when unstable molecules damage the cells in your body. And these can be found in cigarette smoke, pesticides, and other stuff. And physical agents of injury are stuff like a gunshot wound, you physically falling, you getting frostbite, just physical stuff. And chemical injury is stuff like poison, recreational drugs, you overdosing, stuff like that. Now, infectious agents of injury is like microorganisms like bacteria, viruses, fungi, and those are more stuff, that commonly gets us sick. Immunological reactions is when the body's immune system overreacts and attacks itself. There's also genetic defects where, genetic disorders can damage and mutate DNA, like Down syndrome, for example. And nutritional balances where you're not eating right, you need to eat. No, girl, you need to eat. So now let's talk about cell death. Apoptosis is good cell death and necrosis is bad cell death. So apoptosis, I can't say it, but it's basically, it's programmed to die. It's lived out its years. It's good death. Like, it's good. Necrosis is bad cell death, and it's basically when it gets inflamed or something bad happens. So what happens if apoptosis doesn't happen? So cells just don't die, but they can lead to cancer, tumor, and just excessive cell growth. And excessive cell growth, that's harmful. And now excessive death is just as harmful. For example, let's look at gangrene. I don't know how to say it, but it caused because lack of blood flow, and the tissue death occurs as cell die. And this is mainly seen with patients with peripheral arterial disease. So how can we reverse or treat this? So we can remove whatever is hurting the injurious stimuli. We can restore circulation, like improve blood flow. We can use transplantation, stem cells, cloning. Now, chapter 4, stress, exercise, and immobility. So there's two types of stress. Eustress is good stress that positively motivates a person, and distress is stuff that negatively affects you. Like, girl, I'm in distress. You've already heard that term before. So the alarm stage is the first reaction your body has when it's facing stress. Your body it's in fight or flight. It's ready to either face it or run away from it. So me, I'm gonna face it. So what really happens in your body during the stage? Your central nervous system gets activated, and your sympathetic nervous system kicks in, and it speeds up your heart rate, which, your adrenaline glands releases hormones like adrenaline. So the resistance stage is when your body tries to fight off the stress by releasing hormones like we just talked about, like adrenaline. Keep in mind that this stage does not last forever. It's time limited, and once the stress is gone, your body stops this. And then your parasympathetic system kicks in and helps you relax and go back to normal. Now the exhaustion stage is like, I'm exhausted. You win. I give up. So your body resources are used up, and this can lead to problems like feeling extremely tired, overwhelmed, depressed, and you can even start getting like physically sick because of this. And this happens when the stressor doesn't stop. And let's look at McQueen's long-term stress theory. Allotosis is the body's way of keeping balance by adjusting to stress, and allostatic is the wear and tear of the body due to stress. So, what is the factors that increase the allostatic load? It can be repeated stressful experiences, like you just keep going on and on and on, or you're having difficulty adapting to it. For example, elderly people are more affected by this because their bodies take longer to recover. Let's talk about immobility and how we can counteract it. Active range of motions is exercises that the patient can do to, move their own joints. Passive ROM is when, like us healthcare providers, move it for them. There's are other ways. There's isometric, aerobic, positional changes. So this is important to keep in mind because we got to keep moving the patient so they don't get pressure injuries, and we can even give them a special mattress. So these are common places of pressure injuries, and you just want to look at them, and basically just when you imagine yourself laying down, you know what's getting pressured. Oops, that actually is supposed to say chapter 4, but now let's talk about cancer. Also known as neoplasia, is abnormal new growth of cells, and a tumor is a mass of abnormal cells. And there's two types of tumor: benign, which is non-cancerous, is malignant, and malignant, which is cancerous. So, how do benign and malignant tumors look, and how do they differ? So benign tumors resemble a healthy cell, and they don't spread to other parts of the body. Now malignant tumors, they look very different, and they do spread to other parts of the body. They grow crazy and they just invade everywhere. Like, cancer cells are bad people. They don't obey the rules. They're genetically unstable. They lose their features. They can even become immortal. Like, this is giving vampire. You scare me. So let's talk about cancer. Cancer is the leading cause of death behind heart disease. And the risk factors behind cancer is age, which is the most significant. Older people get cancer more. Tobacco use, nutrition, too much fat, too much alcohol, basically all that bad stuff. So our immune system constantly looks for foreign substances, and it destroys mutated substances that can lead to cancer. But as we get older, our immune system becomes less effective, which is why adults more have cancer. All cancers start from changes in the DNA. Like these tumor suppressor genes, they're supposed to help and control slow down cell growth, but they changed up on us. So metastasis is basically how the cancer spreads. Tumor cells, they need to find a place to stick and survive. They often home to specific organs or tissue, but then they spread. So grading is how we determine how much the tumor cells differ from normal cells, and staging is trying to figure out the location and pattern of the spread. So the effects of the body, it can be asymptomatic, like it just doesn't show. There's no signs. You have cancer, but it's not show. And sometimes it can give you pain. Sometimes you can get cachexia, which is extreme weight loss and muscle loss, because cancer messes up your energy. It can mess up your immune system, and once your immune system is messed up, you're going to get all types of infections. There's hair loss because of chemotherapy, and just take a pause and read about all this. Now, how do we treat how do we treat cancer? We can do surgery, we can remove the tumor from the body, we can do radiation where we target and try to destroy cancer cells. We can try to detect it early, we can look at the warning signs, and you can caution up. And these are some of the warning signs that you can get when you get cancer, and these are warning signs that you get when they're in children. So thank you guys for tuning into my video, and study, and good luck.